started when I was 14 years old. I had an abscess, which was on the roof of my mouth. So I went to the dentist and he found that it had killed one of my front teeth. So he recommended that I have a root canal therapy done, antibiotics to treat the abscess, and I had the root canal therapy done, and everything seemed to be fine for a while. I was healthy, I was normal. That was for about 5 years after that, so I was about 19 when things started to change a little bit for me, and my period stopped, and so I went to the doctor and they said, don't worry, it'll be okay, these kind of things happen. And went on for 6 months and they still said, oh, it's okay, all right, we might do a blood test. So we did a blood test. It came back and it showed that I had really high prolactin levels, which is a hormone which the pituitary gland produces. So they said, okay, we're going to do a CT scan and an MRI scan just to check your pituitary and see how it is. Had both of those scans done and they came back and showed that I had a pituitary tumour. It was about 12 millimetres, which sounds quite small, but in comparison to the pituitary gland itself, the pituitary gland is only 1 centimetre itself. So it was actually a macroprolactinoma is what it was called. So that was a bit scary. That I go and see a specialist. So I came up to Sydney and saw a neurosurgeon and an endocrinologist who is a hormone specialist, and they gave me 2 options. I could either have surgery and have the tumour removed, which there was no guarantees with that really. They said it could grow back even if you do have it removed, or we might have to take the whole pituitary gland out if it's grown into the pituitary gland. So they couldn't really give me any guarantees or anything like that until they actually got in there and had a look at it. So I didn't want to do that, at all. The second option was to take drugs, and that would be for the rest of my life, and that would have been a drug called Dostonex. They also said that there was no guarantees with that because they weren't sure whether it would work. Sometimes it works, sometimes it doesn't. And there was a lot of side effects which would come with taking that drug as well. So side effects could include depression, nausea, all sorts of things, and obviously I didn't like that option either. So I was really undecided about what to do. Both of the options I didn't really like. So I was thinking about it and I decided not to do either of them. I decided I'd maybe spend a year trying a few alternative things and see how they work, see if anything happens. If it does, then that would be good, and if it doesn't, then I would go back to the first options and consider them again. I came up and saw Kate, and she checked me out and everything else seemed to be normal, apart from the prolactin levels, which were still really high. They were about 10 times normal, so that was really, really high. Then I decided that I would start to drink wheatgrass. I'd read a few things about wheatgrass saying that it was really good, it could help possibly shrink tumours and things like that. So we started growing that at home and juicing it and drinking it every day. But the wheatgrass was maybe treating the symptoms. So it wasn't actually treating the cause, but maybe treating the symptoms. So then I came to see you, and I had the root canal pulled out, root canal tooth. I was 20 when I had it pulled. I don't know, we couldn't think of anything else that could contribute to the tumour other than I'd been fully healthy before. I exercised, I ate really well, and there was nothing that could have caused it other than the tooth. So I had the tooth pulled, and 3 months later I had another blood test, and the blood test showed normal. And we were very shocked. But we thought, we're not going to get too excited yet, we'll wait for the scan. So I had another MRI scan. This was 3 months after having the tooth pulled, and I got the results back and they said there's no tumour there, it's a healthy pituitary gland. So I was shocked and amazed and didn't know, I was just shocked. And there was no other explanation to say that the tumour disappeared other than having my tooth pulled. I went back up to my...
There was no other treatment?
There was no other treatment. I didn't take any medication. All I did was have the tooth pulled and I was drinking wheatgrass, and that was all. I went back up to my doctor and he was also shocked. He didn't ask me why, what's happened, what's changed. He said, oh, that's strange. He didn't want to know, really. So that was a bit sad, I thought. But the wheatgrass was maybe treating the symptoms, but once I had the root canal pulled out, that was the cause of what the tumour was. So once the cause was removed, then that's why the tumour just disappeared so quickly. It's so weird, though, thinking about what my life could have been like if I didn't have the tooth pulled out. I could have had to have surgery and they could have had to take out the whole gland, and I could have had to be on hormone replacement tablets for the rest of my life. I could have had to be on a drug called Dostonex, which had horrible side effects like depression and nausea every day for the rest of my life. It could have been that. And there was no guarantee with that. It was supposedly supposed to shrink the tumour, but because of the type of tumour that I had, they weren't sure. So they were going to just test it out and see what happened. So, because there was no other option. They don't know what the cause of these kind of tumours are. And apparently they're really common. There's like...
Oh, really?
1 in 10 people have them, but most people live their whole lives without knowing, because most of the time they don't actually grow big enough for people to have any symptoms from them. And my blood tests are normal still, so I've still been having the blood tests and everything's back to normal. So it's
and your period, you're having regular periods?
Yep.
They're normal now, right?
Yep, back to normal.